Western Fair will more than outlast COVID-19 and return better than ever in 2021. In saying that, management and staff have been working behind the scenes on a virtual fair that will provide a series of online competitions, summer fun contests, prizes, fair food offerings, entertainment, and agriculture education. Those details are going to be finalized for your reference over the next couple of months. In spite of today's difficult but responsible announcement from Western Fair, we do have some encouraging news from the province. Just a few minutes ago, Premier Doug Ford unveiled details of the first stages of plans to reopen Ontario's economy. I'd like to share a few of the comments from the Premier. This Saturday, private parks and campgrounds, marinas and boat clubs, golf courses and businesses that board animals will be allowed to open. On Tuesday of next week, we will see the reopening of retail stores that have street entrances, that is to say, not located in shopping malls. In addition, starting that same day, outdoor sports fields will reopen, along with tennis courts and off-leash dog parks. Vets and pet grooming services can reopen, but it would be by appointment, along with home cleaning businesses. In-person counseling and non-essential services can also resume on Tuesday. It should be noted, businesses are not obligated to reopen on Tuesday, but those that do must protect the health and safety of their workers and their customers. The province has noted they will have inspectors visiting workplaces to ensure everything is being kept in an appropriate manner to allow workers to remain safe. They've also doubled their phone lines so workers who don't feel safe can report those concerns. Finally, and as a brief point, I do know that the Prime Minister and the Ontario Premier are meeting as part of a group of premiers with the Prime Minister for discussions on how they can provide support funding, that is to say, capital operating funding for municipalities right across the country. I applaud this discussion. I think it's important. I appreciate the fact that the province of Ontario and the government of Canada are meeting to have this discussion. It's something that we're waiting for. It will be critical. Look forward to those results. Dr. Summers, if I might turn it over to you now, and thank you, Dan.
Thank you, Mayor Holder, and thanks for having me join today. Wanted to provide some updates on the COVID situation in Middlesex-London. As of today, we have 463 cumulative confirmed cases in the Middlesex and London region, with just 2 new cases reported going into today. There are over 21,000 cases in Ontario as of now, and we continue to deal with outbreaks in long-term care homes across the province and here in Middlesex-London, although we are seeing certainly a slowing in new outbreaks in those facilities, and we anticipate over the next number of days we will be able to declare outbreaks in a number of those homes over. So encouraging news in the midst of still trying to deal with cases that continue to roll in. One of the things that we would highlight today is that testing for people with symptoms consistent with COVID-19 is available in the Middlesex-London region. And so if you are experiencing respiratory symptoms like fever, shortness of breath, cough, or if you're feeling generally unwell with new or worsening symptoms, you are encouraged to go to the Health Unit website to use the self-assessment tool, to speak to your healthcare provider, or to present to the assessment centers that are located at Carling Heights Optimist Center and at Oak Ridge Arena. As we look towards the long weekend, the Carling Heights Optimist Center will be open on Saturday and Sunday. Oak Ridge Arena Assessment Center will be closed, but on Friday and on Monday, both of those centers will be open. It's important that we have testing available to those who have symptoms, and that people who are ill make sure, even as we see a reopening of certain businesses and certain amenities across the province and here in the Middlesex-London region, that if you are unwell, that you stay at home and that you use the self-assessment tool or pursue testing. That's very, very important, so that as the health unit, we're able to help you and help those who are confirmed cases of COVID-19 be well supported and make sure that any close contacts are quarantined as soon as possible. So as we go into the long weekend, mindful that these things are reopening, it's really important that people are mindful that COVID is still out in our community, that those physical distancing steps that you can take to minimize your interactions with others are taken, so that we can continue to see a flattening of the curve. our curve is not yet flat, but we are certainly made great success, and we hope that we can continue that trend moving forward. Thanks again for the opportunity to be with you today, and turn it back over to Mr. Flaherty to take some questions from the line.
Thanks very much, Dr. Summers, and thank you, Mr. Mayor. All right, well, we do have questions lined up, gentlemen, so we will get to those right away. Dr. Summers, the first question is for you, and it comes from Dan Brown at the London Free Press. Of the positive COVID-19 cases, women represent a large majority in London and Middlesex. What do you think is the reason for this locally?
Thank you for the question. I believe, and we believe, that the representation of women amongst our COVID cases is higher, likely because they are largely and higher represented in the populations we have been testing. So, for example, our healthcare provider workforce has been an area of intensive testing and surveillance, and women are higher represented in that group. Similarly, residents and staff of long-term care homes have also been highly focused for testing, and we know that women are higher represented in those groups as well. So I believe that is likely led to the higher representation of females in our confirmed COVID-19 cases. As we know, there are likely cases of COVID-19 that we have not identified, which is one reason why we're emphasizing the need for testing and for people to use the self-assessment tool. And we may see a rebalance of that gender representation. All that being said, it's really important that we keep track of which groups are more represented in our confirmed COVID-19 cases. We want to make sure that there aren't groups that are being hit harder than others, and that's going to be a focus for us to make sure that we can protect those groups as much as we can in the future.
All right. Dr. Summers, a follow-up question from Dan Brown, and he, for those who will be watching on the recording later, Dr. Summers is with us today and not Dr. Mackey. So the question actually refers to something Dr. Mackey has said before during these briefings. But can you refresh us on the impact of warm weather on the virus? Once summer arrives, how will that play into the spread of the virus?
Thanks again. Another really important question. And as you've heard from Dr. Mackey before, the role of what we would call seasonality, or changes in infection rates during different seasons, is unknown, of course, with COVID-19, as this is the first time we've seen this disease. So we have to look to other respiratory illnesses like influenza or other coronaviruses that have circulated in our communities before to get a sense or predict what seasonality might mean for COVID-19. What we know from other respiratory viruses like seasonal coronaviruses, so other coronaviruses that aren't COVID-19, or other types of viruses that cause common colds or other respiratory illnesses, is that they tend to decrease in number during the warmer months. And we will have to see whether or not that's the case this year with COVID-19. The reason that we see it decrease for these other viruses during warmer months is because people aren't grouped together or crowded as much as they are during the winter months, when we are often inside and grouped together. So people are spread out a little bit more. They're out in the sun. They're out in the good and enjoyable weather. And so we'll have to see how that plays a role. It also highlights that as we get through the summer, one of the things that we have to anticipate is that we could see a rebound of infections at some point in time over the next number of months, including the fall and colder months. And so we have to always know that as we see an opening of restrictions, we may also at one point in time see a reemergence of those restrictions if we have to be responsive to an increased number of cases. So as we go into the summer months, we don't know what we're going to see, and we don't know what the influence of reopening will necessarily be on that either, but we will monitor that very closely.
All right. Of course, anticipating that at some point the weather will get warmer, even though it hasn't so far.
Big assumption, big assumption.
There we go. Mr. Mayor, the next question is for you, and it comes from Skylar McCarthy, who's with 106.9 The X. Mayor Holder, do you advise people to go out to the golf clubs if open this weekend?
Well, probably it helps if they golf, but I would say to you first that in a serious vein, Golf courses were given the ability to prep to be ready to be open, and that was directions received through the province a little over a week ago. So they've been anticipating this. I would expect that most, if not all, golf courses will be able to will be ready for those who choose to do that. But here's the thing that we know, and we're going to be consistent with the medical officer of health and with what we've been saying, and that is, irrespective of whatever facility, be it in terms of golf courses, be it in terms of marinas, be it in terms of businesses that will be opening, the whole issue of safety as it comes to issues around hygiene, as it comes to issues around physical distancing, the 2-meter rule, crowd sizes, those continue to remain in effect. So it's that whole issue of responsibility that we're looking for people to keep in mind as we look towards this long weekend coming up. We're excited about it. We think having ultimately some better weather, but also the fact it's a long weekend, and that some of the restrictions that have been so wearisome and tiring for people, we get it. But let's not let the new opportunity to stretch our legs undo the hard work that we've asked people to consider over the last 8-9 weeks. That's the only thing we would ask people to consider. So if you play, if you enjoy the game, have a good round, and be careful out there.
All right. Thank you very much, Mr. Mayor. The next question, Dr. Summers, is for you. It comes from Sophia Rodriguez, who is with CBC London. Dr. Summers, as more things start to reopen, do you expect there to be a surge in cases? How does the health unit plan to manage a surge? And are we at the capacity to test a larger amount of the population?
As things reopen over the next number of days or weeks, we have to be very vigilant for the potential of a slight increase in cases. Our observations of other jurisdictions across the globe have been that as reopening has happened, there have been clusters of COVID-19 cases that have emerged as a result of that reopening. So we need to be able to quickly identify those cases and quickly isolate people who are ill and quarantine those close contacts. The health unit does have the capacity to respond rapidly to those cases. Within 24 hours of being notified of a case, we are able to reach all cases and many, if not all, of their contacts and ensure that they are self-isolating as appropriate. And this is all the more reason to emphasize that if you are symptomatic and ill, you should get tested. We have that capacity here in the Middlesex-London region at this time. And so folks that have illness that is consistent with COVID-19, fever, shortness of breath, a new or worsening cough, should be using the self-assessment tool through the health unit website, speaking to their healthcare provider, or presenting to the assessment center for assessment and potential testing. That testing and rapid identification of COVID cases helps us as a health unit to act quickly to make sure that people are isolated and we can break the chain of transmission. And so as we reopen things, it's all the more important, as it has been this entire time, to ensure that those systems are in place.
All right. Well, let's move on to the next question. Mayor Holder, it is for you, and it comes from Sawyer Bogdan at Global News Radio, AM 980 CFPL. Mayor Holder, what do you think of the reopening? What impact do you think it will have on the local economy?
Well, I think anything that gives an opportunity, Sawyer, to give people the ability to shop and to, more importantly, allow retailers to be open, I think that's an extremely positive thing. We've always had grocery stores that have remained open as part of essential services, but to give consumers choices, to give them something different. It's funny that everything old is new again comes to my mind right now, and I think it's true. I think this is a healthy thing, and I think it's positive for the spirit of Londoners. Londoners have shown tolerance and they've shown patience through all this. So as we go through this new phase, we're asking people to be kind, and we know that retailers are looking forward, as they will, to being able to offer their services again, and with the spirit of the physical distancing in mind. And we know that retailers are going to be exceptionally responsible in terms of protecting their employees and consumers. It should be a very positive experience, and we're optimistic, we're hopeful, and it has to be very good for London's economy to get back open again.
All right. Thank you, Mr. Mayor. The next question, Dr. Summers, I think this one is for you. It's from Steve Young at CTV London. What kind of enforcement are we going to see this long weekend from the health unit? Are you adding staff given that more things are opening up?
We will be certainly monitoring with our partners at the city the gradual reopening of services to make sure that these services that are open are acting as safely as they can. And one of the things that we know about businesses in London, and building off of Mayor Holder's comments, is that people care about their customers, people care about each other, and want to do the right thing with taking those appropriate steps to ensure that even if we are having this opening happening, that physical distancing is being maximized, and that these are safe spaces. So we will certainly be monitoring businesses as they open closely. As we move into later down the line, things like restaurants and stuff like that opening up, the health unit has a very clear role in inspections of those facilities, and certainly our hotline, as well as the City of London's hotline, is always available to take queries or questions.
All right. Thank you for that response. Dr. Summers, the next question is also for you. It comes from Grant Demi at MyFM Radio in Strathroy. Dr. Summers, there's lots of shared anxiety among post-secondary students, especially about returning to school in the fall. With large student populations we see at Fanshawe and Western, what would you like to see from the schools in terms of not only implementing COVID-19 regulations, but, in quotes, policing them as well?
We will certainly be working with post-secondary partners in the Middlesex and London region to support provincial guidelines that come down, as well as partnerships across other post-secondary institutions across the province. I think when we look towards the fall, one of the things we will be asking post-secondary institutions to consider strongly is how they can maximize virtual education, how they can limit large group settings likely, as well as if small group gatherings are happening, how do we ensure that those are happening in a safe way? How are we ensuring that appropriate hand washing is happening, that those spaces are being cleaned adequately, that people who are ill are not feeling as though they should be on campus or should be in class? We have found that, as with all our partners and all businesses and non-governmental agencies and post-secondary institutions, that people do want to do the right thing with regards to creating those physical spaces to be healthy and well. And we anticipate that that'll be the case come the fall. But for those students out there who are wondering what their school year will look like, I still think there's some question marks there, and I understand very much the anxiety that comes with the uncertainty. Regardless, safety remains a priority, and I know that Western and Fanshawe and other post-secondary institutions will be looking for ways to maximize that virtual learning environment to make sure that students can learn in a safe way.
All right. I know that that's a question I've heard many times, so thank you for responding to that one, Dr. Summers. All right, we have another question for Dr. Summers from Dan Brown at the London Free Press. I know from Dr. Mackey's tweets that you and he were avoiding being in the same room together for the duration of the pandemic. Is this still the case? I assume this was for succession purposes, and Dan did clarify he meant in case one of you got sick. I assume this was for succession purposes. Is that correct?
Yes, thank you for clarifying, Dan. So Dr. Mackey and I, yes, we have not been in the same physical space for a long period of time. And that reflects one of the general principles we've been taking here at the health unit, as also a principle we've been trying to advise others to take, which is around this concept of cohorting. And that is a way in which we try and divide staff or organizations into groups so that we are minimizing the amount of exposure that we would have with others. When it comes to breaking the chain of transmission, it's really about limiting the amount of physical interactions we have with others and limiting the number of people with whom we have those physical interactions. And so for Dr. Mackey and myself, it was an intentional decision, both recognizing that we could do our work remotely from one another, but that we would also ensure that if one of us got sick, we would still have somebody as a medical officer around. And it also helped to model for our organization and to others that it's important to make sure we were interrupting that chain of transmission as much as possible. All that being said, I do look forward to the day where Chris and I can have a cup of coffee somewhere together again, or share a hug for that matter.
There you go.
All right. Well, I'm glad that made brought some smiles to the briefing today. Thank you very much. That, gentlemen, does it for the questions today. I want to thank both of you, and Dr. Summers especially, for joining us for the first time. Well done, and appreciated having you along for the discussion and for answering those questions. All right, we are done for today. Thank you all for tuning in to today's virtual media briefing. We'll be back with the Friday edition before we head into the long weekend tomorrow at 2 o'clock, and we hope to see you there. Thanks, and have a great rest of the day.